our Facebook pages, both Hot Country Hits 99.9 and 102.7 WMOM. You'll also be able to watch it on our YouTube. You can listen to it on your smart devices like your Amazon Alexa, your Google Home. We're streaming at WMOM.FM and at HotCountryHits.com. And Drew, also over the air. So a lot of options.
I'm glad you're giving people options. That's amazing.
I think radio, I mean, when you think about it, radio, there's never been more opportunity to listen wherever you're at and however you want to at this point. So
that's absolutely cool. True. I listened to you when I was in Wyoming last year. It was amazing to be able to tune in on my phone.
Very cool. Well, thanks for doing that. I appreciate it. Let's talk about over the next couple of minutes, and we had this conversation a couple years ago when you put in the robot, it's the Da Vinci, right?
The Da Vinci XI. Yeah, we upgraded.
All right. And so over the next few minutes, we're going to be talking particularly about this robot and also how Dr. Autrey uses it. Good morning to you, by the way. And I am saying your last name right. Is that correct? Okay, I just want to make sure. There's the camera on you. In your Oreo gear, because you got football tonight, right?
Absolutely. Absolutely. Go O's.
There you go. Well, we'll chat about how you use this robot to really, I'm hoping, can I use the word make your life a little easier? Is that the fair assessment? Or I'm sure it goes deeper into that, maybe more easier surgeries for the patient. Is that where it's
easier
where it's
surgeries for the patient? And to be quite honest with you, it's easier on my body as well. Because I'm not standing in cockeyed positions for quite some time, for a couple hours while we're doing that.
Do you still wear the goggles and everything like that?
Yeah, no. Actually, I get to sit down and at a console, and it's adjustable so it can, so I can have actually good posture.
That's
and
cool.
My back doesn't hurt at the end of the day, which is nice. So.
All right. Looking forward to this. We're going to be chatting with you about that. Drew, let's start and kind of build the foundation over the next couple minutes to do this. Yeah. Your vision at Corewell Health, what is that when it comes to the robot and technology?
We're striving to really make things simple, affordable, equitable, and exceptional all the time. That's something that we've really focused on at Corewell Health. And when people ask, well, what's the end game of becoming a bigger system? Well, to get Da Vinci robots and things like that, so that we can continue to grow and bring good things to the community. So that's really part of our vision as well.
All right, and because this, the comparison from the previous robot to this robot, because you don't have two robots now. You had to send the other one back, right?
It's a trade-in.
Okay,
that's right. There's a trade-in program.
That's all right. But why? Is it just because there was a dramatic difference in this robot versus the previous one?
It is dramatic. Dr. Autrey will probably touch on some of those things, but it's a lot more friendly on the patient, friendly on the surgeon, friendly on the team.
Okay.
It's the cutting edge. Every year, healthcare, continuously, not even just by the year, by the month, we're coming out with new things that are made to make things safer for the patients and hopefully more affordable in the long run as well. And by decreasing the amount of time they spend adjusting and things like that, you have patients less time under surgery, or under anesthesia, while they're in surgery. So that decreases their risk of bad outcomes. So it's really a good thing overall for everybody.
Absolutely. And with this particular a robot, I have a list of these from general surgery, gynecology, gynecological oncology, urogynecology. They really throw me some tough words here, so you might have to continue that. Urology, cardiothoracic, right? Did I get it right?
You're doing great.
Right. I'm doing okay. Bariatrics and surgical oncology. When I look at a list like that, and again, I'm not in the healthcare industry, but that seems like it covers a lot of the bulk of what you would go in for surgery for, right?
Well, it does when it comes to a lot of the things in the torso, particularly. That covers most of those things. It's amazing that just the accuracy that they're allowed to, by use of this robot, that they're allowed to use on patients. We're doing cardiac surgery with a robot, which, you say that a few years ago. Remember how robots were like, you didn't have robots. I mean, the only closest thing to a robot was maybe a car wash.
Yeah.
But now it's, robots are so precise, and you see them in some of the industries around here as well. When you look at what they're doing at Metalworks and Whitehall Industries, great robots as well. But ours are working on soft tissues and working on human bodies, which is, to me, it's always incredible to think about.
And you have Bret working, Dr. Autrey. You have Keith Langloy, Dr. Langloy.
Yep.
You have Kaylee Ann Vanden Duel utilizing this robot, and then all of your OBGYN surgeons too, right?
Yeah, Dr. Gentry uses it, and then now Dr. Ivy, who just joined us full-time this month, uses it a lot. She's been using it for years and years as well. So it's kind of nice to have more and more use, more hours being used on the machine, obviously, because that helps the return on investment, from a financial standpoint, which nobody likes to think about. But it actually is better for the community because there's just more surgeries being performed with this safer, better way.
Yeah, absolutely. And so the first question that comes to mind for you, Dr. Autrey, is are you guys fighting over this robot then, or not?
Not yet.
Okay.
We do have kind of assigned days that we kind of have first access to the robot, but that's going to get tighter and tighter, I think, as time goes on. But and that's okay. The best thing is that with this, we're able to do things from a standpoint of more minimally invasive, which is better for the patient, better recovery, better, all around, less time off of work, all that type of stuff. If we're able to do it minimally invasive, that's the preferred way. So we're able to kind of extend that to quite a bit to some surgeries that maybe were not being done that way beforehand.
Absolutely.
So that's good.
And I guess that's where I was leading to on my question. Sorry for interrupting you there, but take us through like a scenario of what it used to be like in this particular surgery to where it is now, if you don't mind. Just any surgery that just comes to mind for you.
So I think probably the biggest, from a personal experience, biggest thing we could look at is like a colon cancer surgery, let's say. So when when my dad was in his 40s, he developed colon cancer. Obviously, this is a long time ago. But he developed colon cancer, and he had a surgery that a wonderful surgeon in a small town in Kansas where I grew up.
Okay.
And he had an incision from basically the bottom part of his breastbone down to his pubic bone, where he was opened up and had the surgery done. He's done incredibly well. Good. Did really well with that surgery and things, but his recovery was significantly longer. He was 6 weeks of not being able to do much activity, or as far as any exercise or anything like that. Now, when I do that surgery, I do it with a robot, and somebody's got 3 or 4 incisions about as wide as my fingernail, and then they've got another one that's about 2 inches wide down by their pubic bone. And so their recovery from that is I give them the go ahead to do pretty much whatever they want to do from an activity standpoint after about a week and a half to 2 weeks.
Wow. Okay.
And so that's a huge difference. People are going, my dad was in the hospital for over a week. He was like 7 to 10 days in the hospital at that time with, all sorts of tubes and stuff like that because he was, such an invasive type of a surgery. And then now we're able to do that, especially on an elective basis. We're able to do that, and they're in the hospital for somewhere between 2 and 4 days.
Okay.
I did one on Tuesday, and I sent my patient home on yesterday. So I mean that's a big difference.
Absolutely.
From a week and a half to a week and a half in the hospital, and a huge incision and not being able to do stuff. And the other thing is we hear about the opioid epidemic and all that type of stuff and things. This person they went home on Tylenol.
Wow.
Not on narcotics, not on that type of stuff. And so it's a huge difference. It's really the minimally invasive surgery has really been a game changer. Now, we're able to do a lot of things differently with the robot. I was doing these laparoscopically as well beforehand, and we're able to have some benefits with the robot that we didn't have laparoscopically as well. So it's even kind of a step up above just from going from a big incision to little poke holes, so to speak. Going from those two things, this is even adding another layer of benefit from that standpoint. So,
in your opinion, if I can ask you this question from a doctor standpoint, from a surgeon standpoint, do you still feel like and I say this not in a negative way, but that you would still want to be in on some of those surgeries with your hands and so on and so forth, or has this kind of
do a bigger incision, and we're going to go in and get things taken care of that way. So
well, and that brings up which would be my next question, and that is, are the patients sold on this? Does that make sense?
Yeah, no, I think that the Da Vinci system has been around for quite some time, and I think that everybody has really appreciated the fact that it's moved a lot of things to a minimally invasive standpoint. So I don't. This is I think that it's a less of a sell, so to speak, to a patient to say we're going to do this in a minimally invasive manner with the robot than it was, let's say, 15 years ago, saying I want to do this laparoscopically.
Okay.
Just because there's the evolution of surgery has gone from big incisions and things like that to more of a minimally invasive perspective, and people are we have a very informed community. We have a very informed patient population, and they know what's going on, and they know what's going on in bigger centers and things like that. And so it's very nice that we're able to provide. We had the same robot that they have downtown Grand Rapids.
That's cool.
We have the same robot they have in Muskegon, and we have the experience, and we're using it. We've developed a good practice here of how to use that, how to use that effectively, and how to use it safely, and to do the things for our population here without having to travel, an hour and a half away.
And we talk about that a lot in this segment, is that we want to be able, because it's an inconvenience, and people are in pain usually if they're headed to surgery in most cases. Is it like the TV when you mentioned that there's one in Grand Rapids and people are kind of sold a little bit more on it now because they're exposed to that. Is it sort of like what we see on TV?
Nothing is ever like what you see on TV.
Yeah.
But the concept of this is really good. It's a machine that goes up and attaches to specific trocars, and it operates the instruments. The surgeon, we are sitting at a console, and we are completely controlling everything that goes on. So we're the nice thing about it from an ergonomic standpoint, from a longevity standpoint for my career, is beneficial, is that I'm not twisted in a convoluted manner for an extended period of time, trying to do a surgery and trying to get that visualization. I can just easily, push a button, move the camera to a different angle, rotate it a little bit easily, and it stays exactly there. So I can see. So I don't have an assistant holding the camera and trembling and their arms getting tired, and I'm and all that type of stuff. It's a much better and much calmer standpoint with that regard. So
if you're just joining us, and this is great information, I love diving into this because we talked a little bit about it a couple of years ago, but just to kind of recap and see where the advancements have come from, and that'll be a question I'll ask you here in a couple of minutes, is between the previous robot and this robot, what is those differences that you've been able to experience? But Drew, let's when we're talking and we're listening to Dr. Autrey, does it kind of make you proud that we've been able to advance? We've been able to, Corewell Health, obviously, been able to budget this in and make that upgrade?
Oh, absolutely. Yeah, I think that's one of the things that the big benefits of, as I mentioned before, of having partnerships that have a deep bench, so that when they negotiate contracts and go to buy something like a Da Vinci that's really, really expensive, or some X-ray equipment or something like that, we can get a group rate on that and actually save some money. So that's a big benefit. And then even when supplies are super expensive for a Da Vinci, it's incredible. So to be able to save the money on those so that the running cost, we can keep them down, is really what we want to do. That's part of the reason why we do what we do, is to deliver that to our end users, which are our patients, right? So
what do you think, obviously Dr. Autrey's here in the studio, but what is your other surgeons said to you or to your team, maybe initially on or now in regards to using this robot for their surgery, the Da Vinci?
I think it's been, so Dr. Vandenduel and Dr. Langlois, they trained on it, so they grew up with it. they probably wouldn't have come here if we didn't have access to something like that. I'm not sure, but I've never asked them that. But, that's an expectation, I think, of many people in training.
Okay.
But then you look at Dr. Gentry, who learned how to use it after training, and Dr. Autrey did the same thing. Dr. Ivy did the same thing. They love it. And obviously, Dr. Autrey's are well over 400 now that he's done on this machine. And that's an incredible number in when you look at our volumes and stuff, it's a huge percentage. Mm-hmm. So it's really a big hats off to him for using it as much as he has, and really he's a technologically advanced guy anyway, so he likes that stuff. But everyone likes it, and I think that they recognize the safety aspect for their patients.
Okay, absolutely. All right, so going back to that original question that I had a few minutes ago, what's that big difference? You had the Da Vinci, the first series or one of the series. Now we know that you can sit down, you can put like gloves on, right? You put your hands.
Actually, no, we actually don't. You don't even. I get to take my gown and gloves off and go sit over in the console. I even actually take my shoes off so I can feel the foot pedals a little bit better. And I have my speaker behind me, listen to music and stuff like that. But no, the biggest difference. So this is actually our third robot.
Okay.
So we started off with the first generation that we had was called the SI, and it was a very good robot. It had a very good platform from that standpoint, but it did have some limitations. And shortly after we got that, we got the X, which was again more of a fixed platform in as far as positioning goes. The biggest difference between the X and the XI, which is what we have now, is the ability to actually have the robot, the platform attached to the patient, and then we can actually move the patient, and the robot will move with it. So we don't have to completely separate the two. Beforehand, if let's say, going back to the colon surgery, we have a patient in the position with their head down for quite some time, but I may need to move that patient into a position actually with their head up for a period of time to do some more dissection. Beforehand, I would have to completely detach the robot from the patient, move the bed, get to the position that I think I want to be in, reattach the robot to the patient, and then go do surgery. And then if I need to move it back, then we have to unattach the robot, move the bed, reattach the robot. This happened again, just this week. I was able to move the bed with the robot still attached, with me not even having to move from my position, talk to the anesthesia provider, ask them to, I need the head up.
Yeah. Wow.
Move the bed communicates with the robot and the bed move simultaneously. Everything works out incredibly well, and then we're able to just get on and working. So what that does is that keeps you under that kind of magic 2-hour window. I talk about the 2-hour window because 2 hours under an anesthesia, doesn't matter what surgery you're doing, more than 2 hours under that anesthesia, and your risks of infection, pneumonias, blood clots, all that stuff goes up. After that period of time.
I didn't know that. Okay.
You're able to stay under that. It's from a time saving standpoint, and it's just from a resource utilization standpoint as well. It's much better.
This is great. I love diving into this, and hopefully my curiosity isn't. I don't want to take too long, because if you have a surgery this morning, I don't want you to be late for it. No. But for our audience and even myself, how big is this robot? I mean, is it something like when we lay down for a CAT scan and stuff like that? Is it that big?
It's not that big.
Okay.
It's the platform itself. It's got 4 arms that are on it that move around. If it's all condensed down, it's probably the size of width-wise, probably wider than a refrigerator.
Okay.
I would say height-wise, it's probably about the same, maybe a little shorter than a refrigerator. So if you have a refrigerator, if you think of taking the little freezer off the top of a refrigerator freezer combo thing, and maybe expand that by 6-8 inches each direction, you're probably about the size of it, all compacted down. It does extend up quite high. the arms then swing out, and so it gets a lot larger, but compact down is there. And the console is probably about the size. Again, it expands up a little bit and things, but it's probably about the size of just the straight bottom part of the refrigerator.
Okay,
from that standpoint.
This is interesting. What about and if you're just joining us, we're talking Drew Dostal, president of Corewell Health and Gerber Hospital, as well as Bret Autrey, doctor and general surgeon for Corewell Health. You use your feet. Mm-hmm. For what?
So there are energy devices, so like cautery, some of those type of things that we use to activate those instruments that have that to stop any bleeding, to cut through tissues and things like that. So we use those pedals for that, fire staplers, things like that, and then also to help control the camera and switch between arms. So you've got 4 arms on the robot. Mm-hmm. One is for the camera, and you have 3 operative arms.
Okay.
And so obviously you only have 2 hands.
Yeah.
And so you can only use 2 at a time.
Yeah.
So one is standing there holding things, but you need to sometimes move that. So you have a button that you click with that, and then you can control that arm with in a different way, and move that around, and then switch back to between the arms and moving and things like that.
Did you ever imagine yourself, because we always hear like your hands are like gold, right? Mm-hmm. You got to take care of your hands and such. Now you got to take care of your feet, right? In some source there, but not in that sense. But in all seriousness, it sounds like it's making your job easier. But does it? And I hate to. I'm not trying to simplify your work, because I'm obviously jealous of it. It's just fantastic that you're able to save lives. I mean, it's impressive. But what about the nurses in the room and so on and so forth? Do you see yourself using or utilizing as much healthcare providers still?
It's actually we're kind of getting out of that learning curve where it used to be initially when we first started our robotics program here. We had a first assist, a scrub tech, as well as a circulating nurse, and the anesthesia provider and me. So we had 5 people in the room at all times.
Okay.
Now, because with this, we're able to kind of cut back on one of those people. So we still need a circulating nurse. We still need somebody to, the anesthesia provider, and we still need the scrub tech. But that's, and me. Mm-hmm. And that's what so we're able to free up another person. And especially and this is a problem nationwide,
absolutely,
not just here,
the shortages.
with shortages of staff and shortages of especially some of the professional staff, whether it's scrub techs or nurses and things. We're able to shorten that or minimize that up a little bit, and it's able to help with some of that healthcare shortage problem somewhat, in that we're able to do these surgeries and things with a fewer people once we get to the point where everybody is really comfortable using the robot. Mm-hmm. And that's taken a while. To be honest with you, it takes a while because I was staunchly against getting the robot in the first place.
You mentioned that before we went on there,
and now I'm probably, I use it. I've used it the most of anybody, and it's and I have to thank my wife for that because she was the one that told me don't be an old fuddy-duddy.
Absolutely.
So in going through that transition, we really are able to get everybody accustomed to using it, everybody comfortable using it, and so we're going to be using it more and more and more, and that's also going to help out because it's, for the most part, there a lot of besides changing out the instruments and things like that, they're not having to get really in there. They're not holding a camera. They're not, changing a whole lot of other things. So they're able to have a little bit less, stressful time and less hands-on as far as that goes, because you don't have to have somebody in there holding this and holding that.
Absolutely.
and all that type of stuff. So
this is interesting, and you mentioned it, Drew as well did, but 405 robotic surgeries you've done personally out of the 711 that Ludington Hospital has performed since 2019. That's incredible. Are you willing to share this thing? I mean,
my day is Tuesday.
No, it's all right. This is
so good. I get it on Tuesday, and that's kind of the way. But yeah, no, it's really good. I think that eventually, it may get to a point where we're looking at having a second room at some point in time that is able to have that capability. I don't think we're there yet.
Yeah.
And I don't know that the volume of cases will support that, here in Ludington. But it is so nice to have that capability. And I think the other thing is so nice to be able to say, hey, we can do the same thing that they're doing in downtown Grand Rapids.
Yeah, that's cool.
And we can do it. And I would put, I was talking with my partners before coming in this because I was trying to get them to do this talk, but they are in cases this morning. So, but I was talking with them, and we would put our numbers, complication. Everybody has complications.
Yeah, absolutely.
It's the nature of the beast. But we would put our complication rates up against anybody's, and I think that we would come out as good or better than what they do downtown, and what they do in Muskegon, and what they do in Detroit, and what they do in Lansing, and all these other places that they have them. We are able to provide a very good service to our community, and able to do it in a contemporary way that is very beneficial to the patient as well as the community in general.
Well, the confidence that I'm getting from you in this is that if somebody were to have that conversation with you in regards to utilizing your hands versus the robot, you're able to convince them without a lot of pull and to struggle there, I guess, in the sense, right?
Well, even using the robot, you're still using my hands.
Yeah, correct.
I'm still using my hands.
Correct.
I'm still using. I'm controlling everything that's going on, and I think that's a misconception that a lot of people have is that you attach this machine to the patient and then I go off and have a cup of coffee. No, I am doing everything. It's just it's a different way of me being able to do things, and the technology that's behind it, as far as the visualization with the cameras, there's a system to check for blood flow and things like that with the Firefly. It's kind of like a black light and dye that you can do for blood flow. You can also look to see where the common bile duct is, all that type of stuff. But there's some safety aspects to that. But it's still the surgeon is still the one doing the procedure, and so it all rests with them and the judgment that you have based on this isn't working. I need to make a bigger incision because I'm not able to safely progress. Yeah, that judgment is still made. That all of that stuff is still there. So it's still that personal connection is just reusing a different tool, so to speak, to do the same thing and to do it safer, more effectively, and also with less pain and less time off of work for the patient. One of the bigger things that we do is hernia surgeries. When I first got here back in 2006, hernia surgeries, we're spending the night in the hospital, and it was 4 to 6 weeks before you got back to work. And now it's, I tell people, if you don't have a really heavy manual labor job, you can go back when you feel up to it. Absolutely. As long as you're not doing any heavy lifting. Heavy lifting starts at 2 weeks.
That's good. It's convenience. It's overall, it's a huge improvement. There's no doubt about that. Drew, you've heard our conversation over the last few minutes with Dr. Autrey. Anything that we want to include before we wrap up this morning?
I want to pivot just a little bit from while I have Dr. Autrey here. It is actually colonoscopy recognition, basically, month. Okay. So our general surgeons are the colonoscopy performers and endoscopy performers in our communities, both here and down in Fremont as well. So I just want to recognize that, tell people to remember to get their screenings, remind them that we have great abilities right here, and we can take care of you, and we want to do that. So,
and he brought up a very good point, Dr. Autrey did, is that you're not, from a hospital standpoint, going to put some IT person in that to do the surgery. You're going to have those surgeons continue to do the surgery because they need to know what to look for and how to react and take that next step. And I think that's very powerful. It just gives them the additional tools that they can use at their disposal.
Oh, absolutely. Yeah, we still need their knowledge, because they see things. When they look at something, they're looking at it a different way than you and I would, where we would be like, wow, I don't know what I'm looking at.
Yeah,
and they're looking at the cellular level to say, hey, I can see something changing in front of my eyes. It's quite incredible what they can see.
It's cool. Yeah. So thank you for all that you do.
Yeah,
absolutely.
Yeah.
And did you?
Well, I was just gonna jump onto what Drew said earlier about the colonoscopy thing as well. To everybody out there, just recently in the last couple of years, the recommendation for screening colonoscopies has changed. It's always been 50 forever and ever and ever. Okay. Amen. And that changed because we're getting more younger people with colon cancer.
Okay.
So as I mentioned earlier, my dad had colon cancer in his 40s. Everybody should start getting their screening colonoscopies or their screening for colon cancer, however it is being done, to start that at 45. Okay. So make sure that that you do that. That is a big thing. And thanks for bringing that up, Drew. That's a big deal, and that's something that we do a lot of, and we do a ton of it here, and it's really beneficial to the population.
Right.
So
maybe we'll have you on or one of your colleagues to talk about that. I think that would be a very important topic to discuss. So I appreciate it. All right, we thank both of you for coming in today. If you missed this segment, in any case, you can watch it in its entirety on our Facebook page as well as our YouTube channel, either on Hot Country Hits 99.9 or 102.7 WMOM. Thanks, Doctor, for coming in. We appreciate it. And Drew, thank you for always coming in there to keep us informed here.
I look forward to it every time. Thanks, Chris.
You got it. Stand by if you would. We'll have our country station go back first here on Hot Country Hits 99.9, home of your new country, your all-time favorites, and news coming your way next. And for all of us here on Mom FM, we have news and weather as well, and music on the way from Calvin Harris on 102.7. It's Mom FM.
Thanks for making us number one.